Hi everyone, this is Dr. Daniel Shanahan from Legs, Foot and Ankle Associates. This is my amazing laser tech, Terry.
Hello.
We're here to chat with you about our MLS laser treatment modality that we added to the practice approximately 3 years ago. It's known as Tripod Laser Services. We brought in the laser as a means to help our patients get out of pain, recover from surgery and injuries faster, and have a safer alternative relative to more traditional means of medication. And we have had wonderful success. So the purpose of this video will be to talk about the laser, what it can do, what it can't do, and how it all works.
At Tripod Laser Services, we utilize the MLS laser system to help patients decrease inflammation, increase tissue repair, improve nerve function, and aid in pain relief. Laser therapy acts a lot like photosynthesis in plants. However, human tissue utilizes light energy differently. Our tissue actually uses light energy to increase cellular response.
It can definitely make you feel better, and it can definitely do things to make you recover faster from both injuries and surgery and chronic pain problems. Many of the things that we treat, like plantar fasciitis, tendon problems, fractures, post-surgical patients, and many other painful issues are able to be solved much faster than we could ever do before with traditional medication and injections and immobilization. So we're excited for you to be able to have this available at the office. And Terry's going to talk to you a little bit on how it all works.
Laser therapy was first introduced in 2007 and later became available for human use by the FDA in 2009. There have been over 3,500 different U.S. studies that continually break out new information on laser therapy. Specific to each patient's condition, the laser can actually penetrate deep into tissue and alleviate pain, reduce inflammation, and also accelerate a patient's healing process by 30 to 40% in most cases.
Okay everybody, so why do we have the MLS laser? Well, we brought it into the practice because we needed something beyond all the typical stuff that was done. We needed something that was safe, non-invasive, non-toxic, and risk-free and pain-free. All those things rolled into one to help our patients with their problems. And of course, we mentioned earlier what problems we treat: plantar fasciitis, tendon injuries, nerve trauma, post-surgical issues, and just a whole plethora of problems that patients present with. But plantar fasciitis, one of the most common. This young lady has been suffering from very bad heel pain, and we can offer the MLS laser as a means to treat it non-invasively, avoid the steroid shots because everybody hates those, and we're able to get them pain-free without anything toxic going into their body. That's very attractive to the patients. And of course, you have to support that laser therapy with the other things that we do for the certain pathology. For example, fasciitis, we often will tape the patient's foot to support it. We teach them about different shoes, things like that. It depends on the problem, but the laser can be part of their therapy. This is a form of physical therapy. The laser treats you, and you do it multiple times to get yourself better, but we're doing it in a non-invasive, non-risky, safe means to treat you.
We're here with Sarah. She's just received her doctor's recommendation for laser therapy. Once that's been given, we can begin MLS laser therapy. Each treatment is tailored to a specific patient and their condition. Some treatment times may last 10 to 15 minutes if it's an acute injury, or for more chronic conditions, the treatment times may be quite a bit longer, depending on length of time with the treatment, pain, and inflammation involved at the site. By utilizing two different laser heads, the larger Ultra head and the smaller handheld unit, we're able to target Sarah's pain. The smaller handheld unit actually works much like an acupuncture needle in stimulating the area with pockets of energy. When experiencing treatment through Tripod Laser Services, you can expect to receive treatment 3 times a week for 2 weeks for most conditions. In the case of conditions where you may require additional treatment, those treatment times are dictated by your doctor's prescription for the laser therapy.
Hi, Sarah. How was your treatment today?
It was great. Quick, easy, and completely pain-free. I cannot wait to heal with Tripod.
Wonderful. We'll see you back in 2 days for your next treatment.
Wonderful.
Okay, so I hope you've learned a lot from our video so far. There's so much to teach our patients, but this is at least a great little introduction to give you a taste of how powerful MLS laser is to change our patients' lives. But the key thing is to understand what it can't do also. It does have its limitations. You need to understand that laser doesn't work instantly. It's not a one and done treatment. This isn't Star Trek, as I like to say. So when Terry treats you, she's going to talk to you about 6 to 10 to 12 treatments and even management later for chronic conditions, maybe on a monthly basis. Also, it's key to understand that it does not regenerate cartilage and it doesn't change your bone structure. If you have a bad joint, the joint is bad. It's not going to fix that bad joint. It can solve a lot of the pain and swelling around it, but if the joint's bad, it's not going to get better from laser. And also, it's key to understand that laser will not burn you. This laser, by the nature of its design, it cannot burn you, even though it is a class 4 laser, which means it is the most potent laser available in the medical world. So please understand its limitations, but the key thing is when you engage in laser therapy with Terry and the doctors here at Tripod is it needs to be supported by other modalities with following our orders with shoes and tapings and all the things we do to help your pathology get better. But laser can get you away from drugs, from shots, and even potentially surgery. So keep that in mind and let us keep healing you at Tripod. Terry and I will be happy to solve your pain.